All right, folks, welcome back. Week 3 case study. We are talking about Matt again. So, we talked about Matt a little bit in week 1 when we talked about introducing loading, the importance of heavy loading. We've now talked about deadlifting, deadlift science, using deadlifts for low back pain. We're going to follow Matt through the rest of his plan of care. So, we covered visits 1 through 10 in the week 1 case study. We're going to tackle some more visits right now. So, a little refresher. Refresh your mind. Matt came in with a pain rating between 0 to 7 out of 10 at worst. Sharp on the left side of his low back. He had radiculopathy in both legs, but especially down the right leg, in the outside of the right knee. His right foot was numb, big toe especially. He also had radiating pain down his left leg all the way down to the foot. He had aggravating factors of walking over 3 miles. Something he liked to do was take longer walks, 3 to 5 miles in the evening with his wife. He had pain at night, waking up 4 to 5 times a night. Pain with golfing, was not able to golf anymore with his friends due to pain. And he was basically finding no relief, slowly stopped doing activity because of his pain, especially when bending over. His wife had taken over a lot of the physical tasks of the house, all the activities of daily living that go into owning a house, and he had basically just resolved himself to drive to and from work and do as little as possible to try to avoid aggravating his back. Found some relief with deep tissue massage and was taking Advil 800 milligrams 2 to 3 times a day. And we discussed that Matt was probably, fair to say, a moderate to high irritability patient, jumping up to that 7 out of 10, going down both legs, could take hours, the rest of the day, even multiple days for his pain to resolve, which is part of the reason why he had slowly peeled back on so much of his activity. So, Visit 10 is where we left off with Matt. No more back pain, walking 10 miles, pain free. Quadrant testing, objective stuff in the clinic, pain free. Slump test, no longer felt symptoms in his right lateral knee. No numbness, tingling in his right big toe. And he came in, visit 10, and said, hey, I was able to golf over the weekend for the first time in a decade without being painful. No manual treatment for Matt. He's not really having any symptoms. Right out to the gym after reassessment, warm up. Doing some strength, introducing a seal row, so a bench elevated on some jerk blocks, full range of motion, horizontal row. A little bit more challenging, a little bit more focused on the back than something like a bent over row, taking the lower extremity completely out of the equation. Some weighted reverse hyperextensions for the first time, and hitting his core a little bit, having him do some lat pull downs while holding a hollow hold. Visit 11 comes back in, sore but no pain, a little numbness in his right big toe. He really likes cupping, so we did some active cupping, so myofascial decompression, so active forward flexion, in and out of deep flexion with the cups on his back for a few minutes. Feeling pretty good. Out to the gym, warm up. Doing some block sumo kettlebell deadlifts, building quite heavy here, is able to deadlift 124-pound kettlebell off blocks. And then we hit him with a Tabata of Russian kettlebell swings. We've already talked about the efficacy of that for low back pain. So loading him into flexion and extension in the same visit, and then some conditioning, a 12-minute remom of some single arm carries and some rowing. So hitting his core, hitting his back quite heavy this session. Visit 12, again, no low back pain, none of that left side of low back pain. Walking, again, able to walk 10 miles over the weekend pain-free. Minimal numbness, tingling in that right big toe. Working on some hip gliding here, trying to clear up that right big toe numbness, tingling, trying to tackle it a different way than long axis distraction. Out to the gym, warm up. Again, sumo kettlebell deadlift here from the blocks, 88 pounds here. We built to 124 the last time, so we're riding 88 for 5x5 here. Banded plank, reverse Tabata, so band in the J hooks underneath, plank up against it, hold that for a Tabata, 8 rounds of 20 on, 10 off. Really hit the back extensors in the core. And then some bird dog rows with a 26-pound kettlebell. In no conditioning here, we just hit with heavy strength at multiple different joints and let him go for the day. Back that same week. No low back pain, no soreness, no right big toe numbness and tingling. Played golf again the night before, pain-free. Hitting that manual hip glide again. Just not confident that right big toe radiculopathy is completely gone. So trying to stay at it, stay ahead of it, make sure it stays gone. Maybe 5 minutes there. Out to the gym, warm up, more seal rows. He loves seal rows. He loves seal rows in the C2 bike. So that's fine because that's the stuff he needs to get better at. Fine by me. Reverse Tabata on the GHD, holding an isometric hold into extension, and then hitting him with quite a complex workout, 21, 15, 9, 30, 20, 10, 15, 10, 5, cals on the C2 bike, alternating box step-ups, and hanging knee raises. So having him up on the pull-up bar for the first time, hanging knee raises, more complex core exercise, hip flexor, bigger demand on the lats and the low back as well. This can be initially aggravating for somebody. That full body traction hanging from the bar can sometimes aggravate somebody who has some low back pain, but he handled it well. So 21 cals, 30 alternating step-ups, 15 knee raises, 15, 20, 10, 9, 10, 5, like that. Ended up taking closer to 20 minutes. So quite happy, able to hang in there for 20 minutes of high intensity exercise. No back pain. Very, very happy with this session. Visit 14, no back pain. That right big toe numbness tingling back again. Reports some random radiculopathy symptoms over the past 10 days, but he had not been to PT or done any exercise in 10 days. He was gone for a work trip. No manual treatment today. Warmed up, hit some sumo kettlebell deadlifts, and then switched and built to the barbell because he was going beyond the heaviest kettlebell. And so again, like we talked about in the lecture, sometimes you have to go to the barbell just to go heavier. And so we had that conversation this visit of, hey, you're deadlifting the heaviest kettlebell. I can't offer you a heavier kettlebell. We have to go to the barbell to continue to lift heavy and challenge your strength. So switching to the barbell, sumo style deadlift, and building to 105 pounds on the barbell, just getting comfortable with the mechanics of a barbell deadlift, a sumo barbell deadlift. Not as heavy as he probably could have, but again, the very first time lifting a barbell. So making sure he's comfortable with that, making sure we go maybe intentionally a little bit underdosed to ensure his comfort. And then once he's comfortable with the barbell, next visit after, we can really start to hammer it. And then some conditioning, a 12-minute AMRAP, rowing and burpees. Was ecstatic with his burpees. Initially showed him a step down, touch your chest, step up burpee that really limited the back extension motion of the movement. I said, this may or may not bug your back. Try it this way. And as he progressed, he just switched naturally to regular burpees. Throw himself on the ground, back extension moment, jump up, jump off the ground. He said, your way was too slow. I was trying to stick to a round every 2 minutes, and the way you showed me was too slow. So doing regular old burpees, didn't have any back pain. So again, super happy with how that went. Visit 15, no back pain, no radiculopathy symptoms, which is great. Just a little bit sore. Out to the gym, warm up. Reverse plank, reverse Tabata again, reverse hyperextensions, Russian kettlebell swing Tabata. Did it a couple visits ago. He was able to increase by 9 reps, which again is just another way to show to that patient in real time, look how much better you're getting. We did the same exact thing maybe 2 weeks ago, and you added 9 reps to your score. So we know your capacity is getting better, your back is getting stronger. And then a longer remom here, 15 minutes. Suitcase deadlifts with the the farmer's handles. So 8 deadlifts right after your last rep, carry it down and back on our floor. Switch to the other arm, and then in that 3rd minute, max calories on the C2, which is a fun way to program a workout for somebody where their score is on the last minute on a machine where they really have no excuse to not go all out. Visit 16, called, actually tried to cancel on me. Low back, very tight. He had to drive to Florida and back. We were in Michigan, so that's quite the drive. 34 hours of driving in a 48-hour window, basically just stopping only when necessary and to sleep once. Feeling something weird behind his left knee, so we're starting to get some of the radiculopathy symptoms, but again, in a stuck, prolonged posture, many days of not moving. So I had said, hey, come on in. We'll work on you, get you feeling a little bit better. No pressure to exercise today, but let's just get you in and get you feeling better. We talked a lot this visit about the importance of moving regularly, moving every day, that when he is coming to PT regularly, when he's at home doing his home program, when he's walking, when he's active, he feels a lot better. In these bouts where he can't make it to PT because of work or whatever reason, or when he is feeling the worst, and kind of convincing him, regular daily exercise is what is going to make you feel good. And so he actually bought a rower, which is awesome. So I bought him a rower. They're hard to find right now. I managed to find one, bought it for him, and he paid me back. But got a rower at home. In this session, did some manual compartmental sliders. So on his stomach, left leg hanging off the table, putting pressure on as he relaxes his leg, taking it off as he straightens his leg. Just a way to add some manual overpressure to a compartmental neural slider. That wiped out whatever he was feeling behind his left knee. So cleared hot to go out to the gym, warmed up. Did some sumo deadlifts with the barbell, and then did a 12-minute AMRAP, just rowing and step-ups, nothing crazy, like I promised him. Got you feeling better, just want to get you moving, get you back into the swing of things after being gone from PT for a few days. Comes back in, visit 17, no low back pain, no left leg symptoms after the last visit, legs sore, and starts to ask the question of when could I start CrossFit? So his wife does CrossFit, one of his sons does CrossFit, so he is in the back corner of our CrossFit gym is where we do PT. We have a couple rigs back there and a bunch of equipment. And he's kind of looking over and seeing class going on and wondering, when can I cross that line? I said, I think you're very, very close. I think once you can come in, on a regular basis and have no symptoms, I think you'll be ready to start CrossFit and just modify stuff with the coach, just like I do here for you in PT. Some more compartmental sliders just to make sure those left leg symptoms are gone. Warm up, put all of his stuff together in a remom. So PT is starting to get more efficient, starting to throw the exercises he needs to work on into a remom. So did some seal rows, introducing some upper body stuff, again, some more gymnastics bar stuff, some toe touch pull-ups, and then some kayaking on the GHD. So working the core, working the upper body, and working the back. And then some conditioning, cals on the bike, and some wall ball shots. So basically a full body session, kind of helping him march towards that goal of being ready for CrossFit. Super stoked to throw the 20-pound ball as well. And visit 19. Low back pain, none. No left leg radiculopathy. Some more of those sliders. Warm up, do some hamstring work. Basically complaining of just hamstring soreness. And then a remom of goblet squats, C2 bike, and planking. Again, kind of working the full body now, getting him ready, introducing CrossFit movements that he's going to find, like the squat, getting the body prepared for CrossFit. Visit 20, no symptoms, nothing. No manual, out to the gym, warm up, longer remom, throwing a lot of stuff into the remom, doing some block sumo kettlebell deadlifts, lighter here because we're going for a longer period of time. Cals on the ski erg, seal rows, cals on the ski erg again. Just kind of in general getting him conditioned and ready for CrossFit. Visit 21 comes in, no symptoms. Reports he was able to shoot a buck on his property and drag it, 200-pound buck, drag it across his property to his house. No pain. Says, I would not have been able to do this before I started PT. There's no way it wouldn't have hurt my back or that I would have been in shape enough to do it. No manual treatment, out to the gym, warm up, doing rounds for time now. So again, introducing him to the kind of CrossFit style exercise, doing some Nordic curls on the GHD, some toe touch pull-ups, and some rowing. Again, 15:43 on the clock, a longer workout, just kind of getting him more and more conditioned to make the transition to CrossFit. Visit 22, no symptoms, out to the gym, warm up. Some more of the same, some deadlifts, cals on the ski erg, seal rows. Again, just general strength and conditioning at this point. Nothing crazy, starting not really to look like PT at all. On to visit 23. No low back pain, no leg symptoms, just sore hamstrings, warm up, some core work, some glute bridge with single leg sliders, 6 rounds for time. C2 bike, ab mat sit up. Today, conventional deadlift from the blocks. So again, preparing him for CrossFit. We need to conventional deadlift and CrossFits for cleans and snatches and other things. Tolerated it very, very well from the blocks, no issues. Visit 24, no symptoms, just sore. Kind of a soreness that was limiting, so a little bit of hands-on stuff. If Matt wasn't a patient and this was an athlete on the gym, I would have said, hey, just do a slow warm-up on the bike or foam roll or something, try and clear up that soreness before the workout begins. But because he was a patient, we did some hands-on stuff, and then again, out to the gym, rounds for time, seal rows, going heavier, overhead swings for the first time today, so much more challenging on the low back than a Russian swing, going all the way overhead, adding in compression of the spine in addition to that posterior shear, and then some rowing. So really taxing back workout with the seal rows, the overhead swings, and the rowing together. Crushed it, 11:05, no issues. So that's basically the end of Matt's plan of care. Where is Matt now? Well, things kicked off with COVID again. Everything's shut down in Michigan. Matt runs a very large business and can't risk catching COVID and being out of the office for 2 weeks, basically. Just too pivotal to what he does day to day at his work. Has to be there in person, does steel machining or something, so has to be there physically, could not zoom in to work. So staying away from anything but going back and forth to work for a couple weeks. Has that rower at home. He's doing CrossFit workouts from our programming at home that his wife is giving him. So he's basically doing CrossFit in the basement, and then he's just waiting for the COVID vaccine, and then he's going to start CrossFit. So as of this lecture, it's just mid-December 2020, so the COVID vaccine is literally rolling out. So once he gets vaccinated in a couple weeks, he plans to start CrossFit, which is fantastic. So a much longer plan of care than I'm certainly used to seeing, but a patient who came in with a lot of symptoms, very moderate to high irritability, and kind of overall negative expectations that PT could help. Did have that appointment with a neurosurgeon, was planning to get surgery. Who knows what the surgeon would have recommended. From what Matt described, sounded like fusion was on board. So Matt is not getting a fusion. Matt doesn't have back pain. Matt's at home doing CrossFit in the basement with his rower and bodyweight stuff and some dumbbells and kettlebells. And then he's planning to start CrossFit in January. So a complete turnaround in what seems like a longer plan of care, but is exactly the length of time that Matt needed. And it started with way back, visit 1, symptom behavior model, showing him change every visit. This is working, you don't need surgery. This is working, you don't need surgery. And utilizing movements like the deadlift, using higher intensity exercise to bring Matt's symptoms down, increase his capacity so that he could return to normal function day to day, go back to golf, go back to deer hunting, be able to do stuff around the house, again, physically, that are all of his goals. So not being afraid to load him up heavy, knowing, yes, I could have had him lay on the table and tuck his belly button to his spine. Would that have helped his back pain in the short term? Maybe. Would it have got Matt to where he is today, doing CrossFit in the basement, having fun with his wife and his sons? Not at all. So one of my, if we talk about patient success stories, one of the ones that I'm most proud of out of all of them, I absolutely love when I can take somebody who is in terrible pain, who has a native expectation that physical therapy or exercise in general can help them, that's convinced they need pills, surgery, injections to fix their problem, fix what's on their image, when I can not only flip them and help them with their pain, but have them start to be regularly active and see the benefit of regular physical activity that can have on their life. No surprise now that Matt is referring a bunch of patients to us. So helping this guy out through his entire plan of care, making sure he's fully better, not stopping just when the pain is done. Because if we had done that, if we go all the way back, pain was gone early on. Pain was gone in the first couple visits, right? There was still some radiculopathy stuff going on beyond visit 10. But if we had said low back pain is 0 out of 10, discharged from PT, we would not have gotten Matt to where he is today, ready to start CrossFit, ready to make a lifestyle change. So it's really important we don't end when pain is done. We are fully capable of taking people through a prolonged plan of care where they have the strength, the capacity, the aerobic conditioning level, the movement skill knowledge to feel confident walking into a CrossFit gym, to walking into a Planet Fitness, walking into wherever they want to go, whatever type of exercise they want to do, but feeling confident in not only them being able to do the movement and feeling welcome there, but also having the physical capacity to start there. So don't be afraid to see patients a little bit longer than you might think they need, and don't base it just on pain. Make sure they're hitting all their goals. Make sure you're constantly reassessing and working those patients towards their goals. So looking forward to your questions on this case study. Looking forward to talking to you all on Monday night and hearing your Q&A from this week's lecture, the deadlift movement, and this case study.